Anti-malarial treatment hailed by Trump has no benefit for coronavirus patients. French researchers find study is the most comprehensive done on hydroxychloroquine treatment for COVID-19 patients.
This post received a score of 27,000, with an upvote ratio of 84%. Here are the top comments in response to this article.
Why can't they link the study in their reports?
Yeah, I hate having to search for the link every time. Here it is, by the way.
None of their results are statistically significant as shown by their C-intervals. P must be less than or equal to 0.05. None of these studies hold water. Thanks mate for posting the link.
Wait, their study showed the treatment effectiveness to not be significant, or their study itself lacked validity?
They couldn't do an actual random trial, so they manipulated their clinical data to try to get a sample that would emulate a randomized target trial. Their sample sizes were also not very big, so I think it is possible there is a very tiny effect that wouldn't be significant unless you had a much larger sample size. There is an estimated 0.1% difference in mortality, so even if that difference were shown to be statistically significant, it would most likely be minuscule. TLDR, when it comes to the effectiveness of hydroxychloroquine, this is just about the worst result you can get with this data.
Thanks for the clarification.
Why does the front page of the site that published this paper say this?
It's an acknowledgement that the work still needs peer review. By providing it to the scientific community, they may get unsolicited reviews that point out valid flaws or discrepancies. Especially on such a rapidly changing topic, getting it out to the community rather than holding it up for review is important. I can be retracted if a flaw is found. That's not really going to stop reporting on it.
By the time it's peer-reviewed, the public will have made up its mind on the whole thing.
Fortunately, the public usually can't go get dangerous drugs because they read something on the internet, so I don't care what Joe Bob from Arkansas decided.
Generally true, but this drug is already approved for use, so it's possible to get a prescription filled for off-label use. It is getting much harder to get HCQ as pharmacies are cracking down, but far from impossible. The other unfortunate part is that Joe Bob from Arkansas may not be able to get a prescription, but it certainly won't stop him from threatening and trying to intimidate his physician. They get enough of that as it is.
If anything, I think that releasing an article advising against a drug as a solution prior to peer review makes more sense than a drug that could be a solution for the exact reason you just described.
Absolutely, it's infinitely safer to suggest not using a medication before proper peer review than it is to suggest using it. You can always use the drug after review, but you can't take back 1 million prescriptions that have been filled and people already taking it because they jumped the gun on advocating its use.
This video was automatically created by Reddit to speech. The article and comments in this video were selected from Reddit according to their upvotes, and any paraphrasing was performed by smmry.com, without any human intervention.